kicking us off. Thank you. I'm kicking us off with our welcome and introductions before we dive into our full presentation, and just giving some housekeeping notes that closed captions and live transcript have been turned on, but they are not 100% accurate. And closed captions are available on Zoom, iPhone, and Android phones, but live transcript is not. If anyone has any questions or technical issues, please post those in the chat, and the staff we have here today can help you with that. We can head to the next slide. Okay, so I'm going to give us a welcome, a housekeeping overview, and then I'm going to hand it over to our presenters. We have Grace Lynn and Christina Lusk from AIDPH and Laura Perner from CTD with us here today. And as always, this is going to be a very interactive session. We have discussion questions, polls throughout the session, so please engage. Please post your questions and comments in the chat. We have staff here that can pull those forward, and we will have participant Q&A and discussion at the end as well. We can head to the next slide. We want to pause and say thank you to CareQuest as our funder for this programming, who has allowed us to do this robust advocacy toolkits and trainings over the course of this year. So thank you, CareQuest. You can head to the next slide. These are our learning objectives. These were attached to your registration information and are tied to our CEU that is available for attending the session today. We will have information at the end on how to obtain those CEUs, and we're posting these learning objectives in the chat as well. You can head to the next slide. Our speakers do not have any disclosures to share with us today. You can head to the next slide. And just a few housekeeping pieces. We are recording this session. Slides, forms, materials, the recording will all be available on our website following this session. Please kick us off and type your email and organization into the chat to say hello. Again, we expect this to be a very engaged and dynamic session. We want to hear from you, so take a moment to introduce yourself and get ready for some discussion today. And again, if you have any questions about Zoom or about the presentation, please pop that in the chat. We have several staff members here, both from AIDPH and CTD, who will be happy to help you throughout. Head to the next slide. Just a little bit about AIDPH. Our mission is to empower our community to advance oral health through science, education, and advocacy. We're certainly at the cross-section of those pieces here today, using our research to develop out educational sessions and materials on how we can advocate to advance oral health in our communities. And we do this work because we believe in a justice-oriented oral health system. You can head to the next slide. We have 4 communities of focus at AIDPH. That includes LGBTQIA+ people, veterans, people with disabilities, and rural communities, and of course recognize that there's intersectionality amongst all of those communities. These are our communities of focus because they have been historically underserved, marginalized, and excluded, particularly when it comes to oral health access. Head to the next slide. So talking a little bit about the program that we're here today, I mentioned this is our 4th and final training of this series. So these trainings are part of a comprehensive program that we're working on to strengthen state Medicaid advocacy for people with disabilities. It includes training webinars, which we have done live over the course of this year and are available asynchronously on our website. We're building out a toolkit, which we'll talk a little bit more about the final section that's being posted of that later today. We will be sharing a bill bank of successful legislation that has happened across the country as examples for local advocates to use in their states. And there are continuing education credits available with this session here today. Head to the next slide. So Medicaid disability advocacy, and it includes efforts to strengthen policies related to oral health Medicaid benefits. And advocates work to ensure that people with disabilities receive the healthcare benefits and support they are entitled to under Medicaid, and raise awareness about advancing inclusive dental benefits. That's why we're here today, and we're going to talk about how you can leverage storytelling to work towards that today. And to the next slide. So again, we have a series of these trainings I think some of you folks have been to the ones previously, and they will be available on our website asynchronously after. So if you were unable to attend our other sessions earlier this year, you can access those on the website. We'll talk about how to do that at the end of this session. Go to the next slide. And we also have a toolkit that pairs in with these trainings that is meant to be a usable resource that folks can use in their state, download, to work with their organizations and their communities as they advance oral health. Head to the next slide. Okay, so our facilitators here are Grace Lynn, who's the Director of Communications at AIDPH, Laura Perner, who works with the Coalition of Texans with Disabilities, who is our partner on this programming, and Christina Lusk, who is a Manager of Content and Learning Design at AIDPH. You can head to the next slide. So without further ado, I'm going to hand it over to our facilitators to jump into the more exciting part of our programming today, storytelling to engage audiences in Medicaid disability advocacy.
Thank you, Liz. Hello, everyone. Grace Lynn here. I use she, her pronouns. I am sitting in my office at a desk, and I'm wearing a black shirt with a white sweater, and really welcoming all of you to this session today and looking forward to hearing from you as much as you hear from us. When we talk about storytelling, I wanted to set the stage a little bit to say that I think we all naturally think in stories. Some have described stories as the default mode of human thought. Stories support information processing, memory development, and can provide cohesion to complex information. And stories, particularly those about people, can elicit greater empathy than facts, just facts and stats. It can motivate those who hear them to take positive action. It can lower resistance to new ideas. And when we want people to come away with new knowledge of a topic or have increased empathy for others, we should use personal stories for sure as a tactical approach to convey our messages. Next slide, please. So what is storytelling? Well, for our purposes today, we're saying that storytelling weaves facts and figures into relatable narratives. It can make policy issues, for one example, easier to understand and much more compelling. When we use personal experiences, storytelling raises awareness. It can influence public opinion. It can inspire action on social, political, or environmental issues. And when we make that emotional and human connection, those complex issues, that data, those stats, those facts become much more relatable, and they can motivate people to engage, to support, or change behavior and change attitudes, which is what advocacy is all about. So there is a science behind trust building using stories. When someone connects with a story or a character, our brains release something called oxytocin, and that is a bonding hormone that boosts empathy and builds trust between the audience and the storyteller. So let's look at the brain on the left. That is your brain on data. And there are just two parts, those two little black dots, that are engaged in paying attention. But in comparison, the blue brain, the brain on the right, is your brain on stories. You can see there's lots more activity. There's many different parts of the brain, including sight, sound, language comprehension, movement, and much, much more. So Dr. Paul J. Zak is the man behind this discovery of the behavioral effect of oxytocin. And he wondered if that molecule might motivate people to engage in cooperative behaviors. So he did a bunch of tests, and his lab discovered that compelling narratives do indeed cause oxytocin to release and have the power to affect attitudes and beliefs and behaviors. So I'm going to tell you a story of the moment he realized something was going on. During a night flight home to California after 5 days in Washington, D.C., I discovered that I am the last person you would want sitting next to you on a plane. Tired and unable to bang on my laptop in the turbulence at 40,000 feet, I decided to watch Million Dollar Baby. I hadn't seen it, but I figured a Clint Eastwood directed film that had won the Oscar for Best Picture would be a deserved break after a hard work week. It is a wonderful film, and I became deeply absorbed in it. The narrative is circumscribed by a father-daughter story and concludes with an agonizing act. When the movie was over, the man next to me said, "Sir, is there something I can do to help you?" I was crying. Well, not really crying, more like heaving, big sloppy sobs out of my eyes, my nose, my mouth. Everyone around could hear me, but I could not suppress my sadness. After I recovered, I began to wonder what had happened to me. I was cognitively intact, aware of my surroundings and who I was, and yet the story was so engaging that it caused my brain to react as if I were a character in the movie, as if one of my own daughters were the one suffering. Next slide. Dr. Zach did this well, right? Think about how you can make your content short, understandable, and relatable. When I say short, oh, sorry, back one still, thank you. Short means every word and sentence must count. So limit, have you heard the term word salad? More words doesn't mean better or smarter. If it's understandable, we know that others can't understand a concept when they can't imagine it right in their brain. So think about and understand your audience, their perspectives, and what they want and need to know. And finally, relatable. You can use personal anecdotes, examples from everyday life, humor, and more. Because when you're real and you're authentic, you make that connection. Just sharing on the next slide. This is the basic level of a story, right? These are the components. So you have a beginning, you have a middle, you have an end. And in between the beginning and the end, you're building this peak, building to this peak. You're introducing in the setup. You can provide a hook or a lead to inspire folks to keep listening or to keep reading. You create some rising actions. You get to your peak. Then you have your falling actions, and ultimately you're ending with resolution, wrapping up the story with a satisfying conclusion. Stories are typically driven by conflict, which is why that tension bar is there. So some sort of issue, big or small, that the characters need to resolve is how you can think about the story arc. And here are just some practical ways, next slide, to incorporate storytelling. So personal narratives are your lived experiences, right? They offer firsthand insights into the impact of an issue. It humanizes it. So a personal narrative is is a really great way to incorporate storytelling. Testimonies and case studies, and Laura's going to share one of those with us today. Multimedia storytelling, think about, different channels, videos, podcasts, blogs, social media. That these are different ways that you can reach and engage your story, engage your audience in your story. Stories can be strategically framed to highlight urgency. In the case of our topic, this is an injustice, right? We want to highlight potential solutions. We want to get additional people on board with us. And finally, you can do campaigns, you can do events, because those can build momentum. It can create collaborative opportunities and rally support for your cause. All right, let's do a quick poll. And I think Sam is going to set this up for us.
Sam, I can pull it up if you don't see it with your screen. Okay.
So we've got some storytelling elements we're listing here. Let me know when. And I can list them off as we're getting them. So we have 5. There they are. Which of these storytelling elements do you think is the most important for driving change through advocacy? We'll give you a minute to. All right, we're seeing personal narrative is leading the pack, which is great. And testimonies and case studies, framing and messaging are coming in kind of a close second and third there. Yes, I think you've hit on 3 of the 5 that are very, very important to driving change through advocacy. I would also point out, I think they're all important, right? On some level, you can shift your emphasis depending on your intention and your audience. So thank you for participating in that. And I'm going to turn it over now to Christina, who's going to discuss more about a process you can use to have storytelling success.
Thank you, Grace. My name is Christina Lusk. I use she, her pronouns. I am a white woman with dark brown hair, joining you from my office with very colorful Legos behind me because I am a child at heart. So very colorful situation happening. And I'm really excited to talk to you all today about this storytelling cycle. So the first step in any storytelling journey is going to be defining your purpose and your goals. You want to know why you're telling the story, and you're not just telling it just to tell it. All those stories are wonderful. You're doing this for a purpose, and you want to make sure that your story aligns with your broader advocacy goal, that it's reinforcing your key messages, and that it's amplifying your mission. And then you want to figure out who you're trying to reach. Getting to know your audience is really important, whether it's policymakers that might need a little more data to back up the story, or a community member that's really seeking that emotional connection. Knowing how to tailor your story for your audience is especially important. And then storytelling needs to be authentic. Real stories from real people hold power. And these genuine narratives build trust, they evoke empathy, and that's really the foundation of a strong connection. So our goal is to take these stories and pull out those universal emotions that help the audience connect. The story Grace told, where that person saw themselves in that movie. You want to find that kind of universal truth there that everyone can connect to. And then that's what really inspires people to take action. In addition to that emotional connection, we want them to trust us. We want our audience to find us credible. So we pair our stories with data to lend credibility and to create a trustworthy narrative. If there are like partnerships or impactful programs that you're doing that can also illustrate your role in the broader conversation, that can build credibility as well. And beyond that, as Grace just said, well-structured stories are important. Using that traditional narrative arc lets people know what to expect. It builds a sense of urgency, and it reveals the path forward for your audience to take further action. And then think about how you're going to share your story. There's a time and a place for nearly every form of storytelling, whether it's a written narrative, a video. On social media, you want to keep it short and visually engaging. In a blog or a report, you have a lot more opportunity to add a lot more detail. And this will help your story reach a much wider audience, like no matter where they're hanging out at. Not everyone's on social media. And finally, storytelling success is not just about telling a really good story. You want to measure your impact. Are you getting engagement on social media? Are people reading your blog? Are they taking action and filling out, a petition? Define your success metrics from the start and then track those throughout your journey. And then at the end, evaluate, refine your future efforts, and ensure your storytelling remains effective. even with this great cycle, you might hit a few challenges. So I wanted to share those with y'all. One major challenge is ethical storytelling. Even with the best of intentions, and you may have heard the phrase impact over intent, the impact of what you're doing matters much more than your intentions. So even with the best of intentions, you can easily undermine your credibility with misrepresentation or tokenism. So you really want to make sure that your stories are genuine and that they represent the voices of the people that are impacted by this issue. So to address this, one strategy, if you can click for me, Sam, is to build long-term relationships with the communities and individuals involved, having really strong community engagement. That means getting explicit and informed consent, ensuring that the people that are sharing their stories know exactly how it's going to be used. Where is it going to be shared? Are there any drawbacks of sharing my story? Like, what should I know before I do that? And they should have the option to withdraw consent at any time. If you put something up and someone decides that that is no longer good for them to have that up, even though it's already out there, you take it down. Everyone should have ownership of their story. And this honors the storyteller and empowers them to speak for themselves as the true expert. Another challenge you might hit is finding a balance between emotion and fact. Emotion draws people in, but leaning too heavily on emotion can make it come off unreliable or manipulative. Like, are you just trying to play on this emotion, or is there some factual evidence behind this? So to overcome this, a few strategies we have are to ensure your story is backed by data and evidence. The key is to aim for honesty and accuracy. So you want your story to be moving, but also credible. You don't want to have, fallacies, incorrect information, unsound logic, any kind of like misleading presentation of a fact. And if you have relevant visuals, use them. Infographics, pictures, videos can lend credibility and give you that qualitative information without taking away from the emotion of the story. And the last challenge I want to share is avoiding the oversimplification of complex issues. Advocacy very often deals with topics that are intricate, they are multidimensional, they affect people differently, and simplifying them too much can very quickly lead to misinformation. So a few strategies for that are to really break down the topic into manageable parts, to include diverse voices and perspectives. An issue might impact people in different ways. You want to provide all of those perspectives. And then leveraging expert voices as well. An expert might be able to help you explain a more complicated aspect of it. And that also adds to that credibility that we were talking about earlier. So these challenges are not insurmountable, but they do require, some thought to overcome. So you want to keep these in mind as you craft narratives that are impactful, authentic, and respectful. And then in the chat, I would love to know if you've ever experienced any challenges in storytelling, especially in your advocacy work. I know that it's always been a learning curve for me working with different communities and trying to tell their story in a way that honors them. So I'm curious to know if anyone else has hit any of those issues. And while we discuss that in the chat, I'm going to hand it over to Laura from the Coalition of Texans with Disabilities to share a storytelling case study.
Hey everyone. Thank y'all so much for having me. I was going to just share a bit about somebody from our staff who was someone with a disability and personally affected by the lack of access to dental care in Texas. She became very, very involved in our campaign over multiple sessions. And so I was going to Okay, yeah, I can see on the slide here. The person I'm talking about is Susie Angel. She's all the way on the right in the power chair with the glasses. That's my right. I don't know if that's flipped around for anyone else. Oh no, you know what? That's my left. Still can't tell the difference. So I was going to tell a little bit about her experience, read a blog post that she wrote to sort of tell her story about dental care and how she finally got it, and then go through some of the ways that we use that story over multiple sessions in our work to finally secure a dental benefit. So Susie was on the CTD staff as an editor and researcher. She had cerebral palsy, which affected her ability to, among many other things, receive dental care and complete daily hygiene. And in 2016, she wrote a blog post for our website. I'm putting it in the chat if you would like to see it or follow along. That just kind of told like the barriers she encountered on getting dental care and then what she finally had to do to attain it. So it's pretty short. I'm gonna just read it real quick if y'all would like to follow along or reference this later. It's linked in the chat, and we've also got it somewhere in our toolkit. So Susie's story is this. In the past 25 years, I've seen 3 dentists. I was on my parents' insurance for the first one, and he chose to let me pay him in $20 installments after being taken off their insurance. I saw him every 3 months, paying off one visit right before the next appointment. Eventually, I needed more and more major work, which required me to be fully sedated. The expenses added up. While we continued the $20 a month plan, I couldn't pay him off in a timely manner. Hell, I'm still paying him 16 years after I quit going to him. After dentist number 1, I couldn't find anyone else, so for 8 years, I just didn't see a dentist. In 2008, I had to start looking again because of a bad tooth that needed to come out. I found a program that helps people on low incomes pay for dental care, but they insisted on knowing the income of the whole household. This really messed me up because I have 2 roommates and our 3 incomes added together put me over the maximum income level allowed. I couldn't make them understand that this wasn't fair, and let's face it, many people with disabilities are in the same situation. I did finally find a dentist who said he worked with people with disabilities all the time and could probably help me get funding to see him. It seemed promising. He agreed that the tooth needed to be pulled and understood why I needed sedation, so he helped me apply for the funding. When I didn't get it, my mom had to pay for the procedure. I finally got a real break 2 years later when I started working for CTD. Executive Director Dennis Burrell put me in contact with his dentist, who agreed to see me as a pro bono case. I'm quite happy with this provider and so incredibly grateful to Dennis. However, I hate the fact that dentist number 3 has to work for free and use up favors to get an anesthesiologist to sedate me for major work. I feel bad that other people with disabilities won't get these opportunities. Between cost-prohibitive care, insufficient aid programs, and a lack of training among dentists for working with our population, the barriers to quality dental care for people with disabilities are staggering. Luck was a factor in my securing adequate dental care, but it shouldn't be. So that's the end of the post. And in addition to sharing that on our website, we also shared that on social media. Susie presented it herself at any opportunity we got, whether we were tabling an event or doing a workshop, any audience that we could connect with, just to sort of raise awareness of this issue. She was ready to be front and center and tell people why this was a problem. And I will point out that Susie was on our staff, so it was really easy to continue to keep her engaged in opportunities to share her story. And, that won't always be the case with the folks that y'all get to share their stories as you're doing your advocacy in your own states. But I think that something Christina mentioned when she was talking about ethical storytelling, keeping the storyteller engaged to the extent possible throughout your campaign, throughout your advocacy work, can be a real asset, not only to have them spotlight their own story, but to keep them in control of telling that story and, updating it kind of as things develop, which was the case with Susie. There was a whole, all kinds of aspects changed from when she first posted this blog to, the third session we were working with the state legislature to get this dental benefit. And she was able to make the choice of how she wanted to adjust her story as she went. So just wanted to mention that. Do I still have a little bit of time, or can I keep going? Okay. I could keep talking about this, so I don't want to go too far over time. So as I mentioned, we worked for, I think 4 sessions to get this bill passed. Susie was very, very involved for all of them. She gave testimony in 2017, 2019, and 2021. We have our expanded case study, which will be linked in our toolkit, that has a really great rundown that our former policy fellow Jay did of how each piece of testimony in each session was woven together with others, so that you had some that were more focused on personal stories and some that were more focused on data, and the way that they supported each other throughout hearings and throughout like longer campaigns. Jay really does a great job of walking you through how all of that worked. So definitely check that out if you have some time. And there are links in that extended case study to each of these pieces of testimony. So you can actually hear Susie telling her story and others and see how they work together. So just a few other items that came up from Grace and Christina that I wanted to touch on are when we're talking about emotional appeal, especially if you go and watch these testimonial recordings from the Texas House and Senate, it's really interesting to see how some legislators are like not reached at all, like, okay, thank you for your time, next. But others, you can really tell when it hits them and they like want to engage with Susie and talk to her and solve this problem. In particular, the first time she gave testimony, Senator Kolkhorst, Lois Kolkhorst, who's very, very powerful senator, is like leaning over her desk to talk to Susie and thank her and tell her how she really related to this story because of a family member who needed care and had to have other people provide dental care for her. So this hit her on an emotional level and through her own personal experience. And Kolkhorst wound up being a major legislative champion on this issue across multiple sessions. And hearing Susie's story was that first touch point. So it really made a big impression. And the last thing I wanted to touch on was we talked about how, or we might be talking soon about how an important aspect of telling a story is whether you're highlighting a specific problem or solution. And one thing that was really interesting that Susie did with her story that I just read and that she continued to do as she told it over, many years, is that she's not only explaining how the lack of access to care personally affects her, but she's also refuting something our former executive director, Dennis, called magic dust solutions. And these are things like pro bono dental care, foundations providing free dental care days, aid programs, all of these things that are really, really great and absolutely make a difference in the lives of the people that are served by them. However, we can see, because there's still a huge gap in people accessing services, that they're not robust enough to address the need. And so as Susie is telling her story, she doesn't have to make a policy argument or say we need X number of dollars to create XYZ program. She's describing how what is already in place isn't meeting her where she is and isn't serving her. And so I think that that's just a really good example of, I guess, indirectly illustrating how the current program, the current options available aren't enough, and we need, we need a public policy solution to really address this on a population level. And she didn't have to use any kind of like political language to do that. She just told what happened to her. So that is all I had prepared to share Susie's story. And if y'all have any questions, definitely let me know in the chat. Thank you.
Thank you, Laura. All right. And what a brave story to tell. And what you said at the end, I think really sums up why storytelling is so important, that you don't have to get into all of the policy discussion right away. And you don't have to know everything, but you know your story and the impact. So thank you. Next slide. So going back to that cycle that I discussed earlier, in the chat, if you want to talk about what steps from the storytelling process you noticed in the case study, there was a little bit of chatter going on in the chat already. And I think that we see a lot of those kind of rise to the top, especially that emotional connection. So yeah, next slide. So in the toolkit that we currently have in development, we have a section called Getting Started. Little things you can do to just get started with storytelling that are quick and simple. And the easiest thing you can do is, if you are, involved in the advocacy work and it is impacting you, sharing your personal story is a great way to get others to share their story. And it's just, you don't have to find anyone. It's the easiest one to do. So there's nothing more powerful than your authentic experience. It humanizes your cause. It makes your advocacy relatable. It makes it very clear why you're doing the work. So focus on the key moments and turning points that really made the issue important to you. Next slide. And then if not you, other people. So interviewing key people, leveraging testimonials, finding individuals directly impacted by the issue or those who are already advocating for the cause, partner with them, ask about specific moments that changed their perspective or motivated them to take action. Getting a story from someone doesn't have to be difficult. Grab a cup of coffee with them, conduct it as more of like a conversation instead of a very structured interview style. Ask them about their experiences, what motivated them, and then collect these testimonials. Feature them regularly on your website, social media, wherever you can. Stories are powerful and reminds people that advocacy work is grounded in real people. Next slide. You do not have to know how to write a novel to share stories. So Grace did give us a wonderful narrative arc, but you can also share short stories with that same structure, creating brief posts that highlight just a powerful quote from a story or a quick snapshot of someone's experience. Instagram, Facebook, all of your social media platforms are great for this. TikTok, short form video is very impactful right now. So make sure to incorporate those visuals because they grab attention and they boost engagement, and people are much more likely to remember things that they saw. Next slide. But if you are a writer or you feel like writing, you can start a storytelling blog. It's a great place to house your long form content on your organization's website. Guest writers may want to join you, a community member, an expert might want to contribute. And it also gives you like a home, a bank for your stories that you can pull from whenever necessary later on. And lastly, infographics. I mentioned this earlier when we discussed challenges in storytelling, but infographics can make complex information much more digestible. Pairing an infographic like this one that reports on the coverage for adults with intellectual and developmental disabilities with a story from someone who is impacted can really make a difference and help audiences see the gravity of the situation. And looking at this map, one color obviously takes over more of the map than the other, so they can see just how widespread of an issue this is. All right, I'm going to hand it back over to Grace for some discussion.
Yeah, thanks, Christina. Before we jump into this, I wanted to just acknowledge and thank everybody for the great thoughts in the chat thread. And I wanted to point out too from Laura's story that when we think about the storytelling, it's typically one component, right, of a more long-term effort and campaign. Storytelling is so powerful, but there's probably other things that are part of your advocacy initiative. And in Christina's cycle, when she talked about that, establishing your goals and your purpose, and we do have those pieces for the storytelling cycle, but you may also want to be thinking about it. This is not a one-off, right? And the relationship building is so critical. And you may have to, tell the story multiple ways, multiple times, and multiple channels. You may need to reinforce it with some other materials. So, storytelling is powerful as it is. We want to make sure you're also aware that you want to wrap this, I think, in a very integrated, kind of thoughtful way and campaign. Okay. So we want to leave time for questions as well. But what would a storytelling webinar be if we didn't open the mics and hear from some of you? So we would love to hear if somebody has a storytelling success they'd like to share, a challenge, maybe someone you admire for their storytelling skills and expertise and why that is, why they resonate with you. So please jump in. You did a great job in the chat. We'd love to hear from a few of you here. So unmute and jump in.
I'm also, Sam, we can probably stop sharing slides for a minute. I posted the questions in the chat. So, and if
Thanks.
folks are able to pull on their video while we're in group discussion, that would be lovely too.
Thanks, Liz. I know it's hard probably to not think of a political example right now because we're just inundated, right, with different types of storytellers. I had one just to kick us off. I was thinking about Steve Jobs, right? And I'm an Apple person, I'm a Mac person. And didn't he do an amazing job with his narrative and his brand, right? Like how he took everything about Apple and embodied it, and he was such a great on stage person and storytelling because he really was on brand at all times and on message at all times. So that was one that came to mind for me.
I also know that we have several folks on the call here with us today who just participated in our Day of Action in Washington, D.C., where we were educating legislators on oral health access. And I know some folks leveraged their storytelling skills during that. So I'll let you mull that over before I call on someone specifically.
Good afternoon, everyone. My name is Barbara Clyburn. I'm one of those fellows that she was referencing. During our lobby day in DC, actually, we had the opportunity to leverage storytelling while we were talking to either staffers or the legislative members. So specifically for me, since we're trying to leverage the fact that oral health is now being talked about frequently on the Hill, and the CareQuest survey that went out saying that 9 out of 10 people actually want their legislators to, do something about oral health care access. I used my husband's story, who is a veteran who served our country for 10 years, and unfortunately, despite his disability rating, does not have dental care coverage. So being able to bring that home by personal experience, I think definitely is meaningful.
And I can follow up with, I'm Steve Geierman. I'm a dentist who practices in the public health arena. And my advice is about cultural humility, and appearing vulnerable often opens up people to you. And I'll just tell you, I worked in a community health center where I would walk by the pediatric area constantly, and I would hear moms saying, "My baby's been running off." And I must have had a look of disgust on my face, because I'm thinking, oh, they make harnesses for those little kids, and the mom can put that little stretchy thing on their arm. And the grandma looked at me, who was sitting there, and she said, "Honey, come here." And she goes, "Running off? That's diarrhea." As I slunk back to my dental clinic, let's just say I was vulnerable. But the next time that grandma saw me, she was warm and inviting. And sometimes we don't have to be in control. We just have to be human. Don't let your babies run off.
Thanks, Steve. And any questions we could entertain in this time as well?
I just have a quick story about learning about storytelling. I think it starts with us learning to introduce ourselves in the space we sit in. So if I'm going to introduce myself in the space of school-based health center, I hope I have a story I can tell. So I just start with my audience being able to relate to me. And so we've just been starting to practice that internally with ourselves. And I'm not leading it to an advocacy campaign. I'm not, creating a big story arc or stuff like that, but we have to be able to get comfortable just telling a story and then moving beyond that. And so that's just been something we've at SBHA been starting to work on. 2 cents.
That's a great 2 cents, Tammy. I think, we're so digitally connected that sometimes I think we forget that kind of old school, hi, who I am and what I'm about. And I think that's a really great example of, coming from an authentic space and creating that initial connection to people. So thank you.
Hi, I'm Casey Huber. I'm with the Arizona Oral Health Coalition. And on our website, we have some shared stories of lived experience. And it's really interesting. One of our storytellers, the one that's front and center on the website, has one of the most authentic messages, to your point. Wisdom and charisma is second to none. However, the gentleman is not a professional, doesn't have the largest vocabulary in the world, but you know, that's the thing is really
Did we lose?
how,
Oh,
uh,
you're back. We lost you.
sorry about that.
Okay.
Yeah, it's really amazing how we can, as people wanting to support people and telling their stories, or choosing the right people to tell their stories, we can never assume capacity, you know, regardless of, you know, educational status, you know, professional prowess, because like I said, the gentleman who's sharing his story in this, in one of our advocacy lived experience videos, is just so eloquent and authentic and wise. It's the kind of story that doesn't just share things with the listener that they didn't know, but it also reminds them of things they forgot. So that's all I got.
Oh,
Thanks.
that's awesome. Thank you, Casey. Yeah. Yeah, you don't have to be the polished, right? Like, it's who you are. It's that authentic piece that makes the connection. So I'm really glad you talked about, you know, kind of seeing people where they are and hearing their stories from where they are as well. All right. We probably should move into closure, Liz. Does that feel right, timing wise? Okay. So we tapped on these early on, and I just wanted to do it one more time to say that these toolkits, and we shared just really a snippet of some of the content for this section 5, frameworks for storytelling. So when we have that ready to release, and it's darn close, you'll want to take a look, because there's more examples. You know, Christina did a few examples of challenges and solutions, and try this first. Like, there's a lot of things there for you to use as tools. Similarly, in the other sections, there's case studies, there's stories already built in. So, you know, we really encourage you to look at it as your toolkit, you know, all the pieces from understanding the landscape through, you know, the storytelling piece, that they're connected, and that you can use these as a resource as you're developing your advocacy. All right, and I think I'm passing it back over to Liz and the ed team.
Thank you, Grace. And I just want to say a big thank you to everyone that's here with us today. It was an incredibly robust conversation that was happening in the chat and off mute here on video. So thank you so much for your engagement and participating in a very engaged manner. That's, I think, what makes these sessions successful. And helps us bring them home to our organizations and our broader community. So thank you for your engagement today. As I said at the top of the call, CEUs are available for today's session. We are going to post that link in the chat right now. Attached to that CEU request is an evaluation, which is very important to us. We always want to ensure that our programming is meeting our community's needs. So even if you aren't interested in a CEU today, please take a moment and fill that out and let us know what you think. You can fill out the evaluation without requesting a CEU. And we thank you for your time and your feedback there. In the same vein as feedback, we are also collecting feedback on the sections of our toolkits as we're releasing them. We have a link for that as well. We will be reviewing all of our community's feedback and doing a final pass through and edit and making changes before a final push publication with all the sections together. Again, we want to ensure that our tools are as useful and valuable to our community as possible. So if you have thoughts and feedback, please share them at this form here. Again, we recorded this session, and we will post the recording and the resources from today's session on our email, on our website, and we will email you, excuse me. And again, take a look at that toolkit. Please share it broadly. It's meant to be a community resource, and let us know what you think and if you have any questions. And thank you again, everyone, for joining us here today. I hope everyone has a great rest of the day.